How's it going, guys? So this is Dr. Suh at Specific Chiropractic, providing Gonstead Chiropractic in Manhattan, NYC. So I have a special guest, flew over from Miami, Florida, of all places.
Yes.
So, what can I do for you, sir?
Low back pain and right leg pain. Basically, when I walk, I cannot pretty much run because of the pain.
You cannot put much weight on it, is that what you're saying?
No, I cannot run.
Oh, you cannot run?
Yeah.
Okay. So when you run, what happens?
It starts hurting really bad, and it comes to the point I have to stop. Basically, like
Where do you feel the pain, sir, when you run?
the whole leg.
On the front of the leg, the side, inside, or the back?
The front, but it feels like it's going numb. The whole leg, I would say. And then I start having sharp pain on the low back.
Can you show to the viewers on the back? Where do you feel it?
Right at the bottom of it.
Okay. Look. So that's the fifth lumbar, this is like the fifth lumbar area. He's pointing to the sacrum. So something's in the sacrum he's pointing. All right, so anything else, sir?
Neck discomfort, a lot of it, basically. And some left shoulder problem also going on.
Okay.
Right now, like, cannot really lift because there's like a sharp cutting pain here.
Do me a favor. Okay. What I want you to do is this. With your left one, thumb this way. Straight man. The thumb forward like this. Release only the left, straight forward, please. High as you can.
Okay. I can, yeah.
Not a problem?
But there's also like clicking, just click.
Yeah, I see that because this is not tracking right. It's not going interior to the line. So what you do is go sideways, go ahead and raise it straight up. See, it catches right there. How high can you go?
Okay.
Yeah, see, you're compensating, you're rotating too much. Okay.
Yeah.
All right, so something's going on over here. Scapula is not tracking right, humeral is misaligned. So based on the history and based on when I look in the x-ray, there's already something really not textbook about this case at all. So I'll discuss that more in depth during the x-ray analysis. But right now, on the top of my head, just looking at this thing, there's something going on with the sacrum and the hip, the ilium. So I'm gonna take a closer look, see what's going on. Basically, when the tissue gets damaged, okay, we're looking for that inflammatory process. And when there's, the body recognizes something damaged in the area and increases the vascular supply to introduce more white blood cells into the area. So one of the defense mechanisms could be more swelling, okay, and we see something puffy over here, a lot of swelling over here, and also muscles are going to be tight to try to stabilize something here. So there's already something going on over here. So, and this device, what it picks up is because of the increased vascular supply, it's going to have an abnormal increased temperature. So that's what I'm already feeling here. This is much more warmer compared to here and here. So clearly something's going on here. Now, let's see if there's anything else going on. See, it's also something's pinching up pretty bad to the point he has core pressure. So the instrument is showing that, nope, the needle's stuck all to the left, all straight down. So there's something really going on. Here's another reading right there. Yeah, over there. It's a little down right there. Thank you. Yep, right there. And really that potential right there. Okay, so now I'm overlaying the data, what I see in the x-rays to a spine. And in essence, there's basically, he has one curvature over here, another over here, another over here, and another way up here. So, because there's quite a bit of swelling over here, we're now going to double check and confirm. How's this fellow over here? Tender? Pain?
No.
Not too bad, huh? But it is swollen on this side, on the left, more so than the right. Okay, now let's see. Okay, that's a brick wall. That left ilium is not moving whatsoever. It's stuck. Yep. is just not moving. See, the right one's gliding just fine. Let's check the sacrum. So he's somewhat fixated on the left-hand side and also the right-hand side. Let me check every sacral segment. See, that number 2 is stuck. That's not moving too well either. Tender right there, sir?
Oh, yeah.
Okay, now we found that problem. What about here, sir? Nothing?
I don't feel like pain.
What about here? Nothing?
Sensitive,
What about this one right here?
yeah. That's kind of.
Yeah, fork lumbar is not happy.
Oh, yeah. That's good.
What I do see on the x-ray, he has one wicked side slip. How's that fella right there?
Oh, yeah.
So that may explain that core pressure he's experiencing there. He's badly rotated in there. Okay. Okay, we're still gonna mark it. It's not exactly ideal. Yeah, see? You feel that right there?
Mm-hmm.
There's a big knot in there.
Yeah.
Right? So there's a lot of swelling, a lot of muscle spasms, trying to guard and protect this 6th cervical over here.
Yes.
Yeah, that's not happy. The 5th cervical is not happy either. It's all jammed up in there. So in terms of X-ray analysis, this one makes this case not textbook whatsoever. Now, most Gonstead docs and students, when they take a look at a posterior sacrum like this, all right, and also based on exam findings where you're fixated on trying to go from inferior to superior, a lot of people, and also with this parallel disc level, they would think, oh, we have a base posterior sacrum. The problem with that is I'm looking at this pelvic brim and also the vertical height of the issues itself. Now, with a base posterior sacrum, okay, when this thing goes backwards, the whole entire pelvic brim, to compensate, it should go forwards. Or, as in other words, we should see a bigger pelvic brim cavity. Mm-hmm. Why are we showing a much more narrow? The vertical height is much more narrow. So in essence, your pelvic brim, it did this. Why is it doing that? It doesn't make sense. So in other words, it's sort of like you're driving a car, you want to make a left turn, but why is the car turning right? That doesn't make sense, right? So that's what I was explaining before. This is not a textbook case at all. I'm seeing this, and on top of that, see this over here? This should be symmetrical. But why is it so blade-like? That means this, the left hip over here, it rotated so much, it gives that blade-like appearance. This is also somewhat narrow as well, right? So that tells me, it says, hey, wait a minute, we have something that's very severe, posterior, inferior, and external rotation on this left ilium itself. So why do we have that conflicting information? Why is this sacrum itself backwards? Because if that really is a major, it should light you up. When I did the examination on you, you should be like, whoa, what the heck's going on with that left hip joint? It didn't do that. Yeah. But one thing that kind of tells me is the fact that you were running, and also during the history, you told us in the past that you couldn't even walk past 15 minutes.
Yeah.
Okay? So when you try to walk past 15 minutes and you're limping in that kind of gait, and I saw how you walk, okay? In addition to, we can show to the viewers real quick. Okay, come back. So there's already, seeing on the gait analysis, you have an increased Q angle. And then I'll show you to the viewers how you march. Okay, okay. I want you to do is this. I want you to raise your knees up to this level. Go ahead and march in place. See, you're externally rotating on this hip. Okay.
Yeah, I can feel when I walk.
Okay.
My left.
Right, and turn it on. Mm-hmm. Okay. Next I want you to do is this. Go ahead. Now I want you to go right behind me. I want to see camera straight down there. Go ahead. March in place. You can also see to the viewers, his leg, left leg, it's tilted towards this way. Okay. So there's an EX ilium in there. Mm-hmm. That's what we're talking about before. So we clearly see on the delay test that left EX ilium is actually the real problem. Okay. However, now, why we have this conflicting data? If that truly is the real old problem, the sacrum should be very anterior. It's not doing that. So when we take a closer look, we see one heck of a huge posterior open gap wedge on the back. Is that second sacral segment. So in other words, this is a more recent acute injury. That's what negated that problem. So if you didn't have this problem, okay, then this sacrum will be very anterior. All right. So that's what the answer is going to be. We have to adjust this one first. All right. And then we're going to see if we need to address this, but most likely it's going to be in a future visit that we need to unravel this mess over here. In addition to that fifth dorsal over here, it should line up with the rest of the spine over here. But instead, this vertebrae over here, what it did was it went way back this way and this way as well. So it tilted and pinched the nerves like it went backward. It went backwards like this, but it went pretty severe and significant like this. All right. So bad enough that it actually compressed and put a lot of pressure on the spinal cord itself. That's what I saw my instrumentation reading. It just usually when I look at my reading itself, it should just like meander a little bit, something along that, along with the muscle spasms and so on and so forth. It didn't do that. It just stayed just 8 points straight down until the fourth lumbar vertebrae. So yeah, that tells us, yeah, that's a significant side slip over there, because this one over here, there's so much rotation from that EX ilium. Okay, so then your body, it didn't just do this, it went way over this way. That's what we see, this blade-like appearance. So in essence, from here, it just did significant like that, a lot. All right, so that's what we see the twist over here quite a bit, and then recompensates. But however, that's why it took a hit as well. So first things first, let's go ahead, let's address that one first. How's the right hip?
This used to click.
And now?
So much. Wow. It still clicks right now, a little bit, yeah.
A little bit? Okay.
The clicking is there, but yeah. The pain, I cannot quite, yeah. I don't feel that much of a pain in like right now, I think.
Right. Oh. How's the chest?
Yeah, it is better for sure. This part is better for sure.
The reason why I got better is because on the x-ray over here, see all these ribs? They should be symmetrical. Okay? But what happened to that one? See this one over here? Much more higher. It's not the same compared to the left one. The right one popped out. That's why it made me really focus on that fifth dorsal over here. That's really in trouble. So that's why we have to really realign it, get that rib also back in place as well. So that's why you notice the chest much more calmer. How's the neck right now?
The neck definitely is less pain.
Mm-hmm.
When you check the sixth cervical, I think it's definitely less pain right now.
So that's what we're going to start doing that's what we're going to do over today's visit. Your 2S and that fifth dorsal over there. We took a lot of that biomechanical stress off your spine itself. Let the rest of your body start healing up. On the following visit, all right, we're going to keep an eye and see what's going on with that left EX ilium. And we'll address it when it's ready for it. All right? And I'll offload even more tension off your mid-back and the rest of your neck as well.
I feel lighter on the sacrum area, a little bit lighter. I feel like the pain shifted to the little bit upper side on the lower back.
Okay.
Definitely. When I walk, and I felt a little bit on the hip, left hip, some pain. You actually told me that might happen. So that's kind of happening. And overall on the mid-back side, I felt much better, to be honest.
Great.
Yeah.
All right. That's okay. Yeah, good.
Something is different here for sure. I cannot quite tell because I never felt it this way, I think.
Yeah, because we just realigned it. So already I saw the way you're walking in, and now you're just walking just now. Your Q angle is significantly more symmetrical to your right leg.
It feels this way, right? A little bit.
Correct. Because before your Q angle, you were more like here, quite considerably that way. And now you're more like more leveled out. So that EX just took a lot of the biomechanical tension right off that fifth dorsal. Let it go. You got a part of it already. Let it go. Just let it. Oh. There it is.
Less pain.
Less pain. What else?
Because when I was lifting, there was like sharp pain right here. I still feel a little bit, but I would say it's maybe halt.
Right. So how much improvement would you say right now for that left shoulder of yours?
50%.
30%. Yeah, that's a great start. Now the reason why we had to address your neck first is because the nerve that goes to your bicep tendon, to the bicep tendon over here, that's what you felt over here. But also the 6 muscles. All the nerve roots is here at the 5th and 6th cervical nerve roots over here. So that's why we had to address this one first. So that's why you experience that 50% improvement in your shoulder, and we didn't even adjust your shoulder yet. Okay, so you have one heck of a wicked AX humerus in here. See, SC, AC is just fine, but humerus is out. There's that fella. Okay, stand up. Give it a try.
Okay, I can move around, right?
Sure.
Oh.
Wow, what?
Little, even less pain.
Okay, so how much less?
Now it's 7, like 70%.
70% better.
Neck feeling better. And the left hip, I think, little bit less clicking, I would say.
Good, good.
So there's this clicking, right? It is kind of a little bit milder.
Good, good. A little more. Okay.
It is
So
lighter.
lighter.
Definitely, there's
Good.
That was like a crazy adjustment, but
Good. Good.
it affected the shoulder. Definitely,
Well, it's supposed to. That's a nerve to the shoulders. All right, so today's the last visit. Give us the latest updates. How's everything doing so far? How's the low back?
compared to the previous visit. It is milder, the pain, but
Right.
still the same spot, going down the whole leg, bottom of the foot. It's
Okay.
still problematic. Neck doing better.
Good.
Chest doing better.
Good.
But shoulder is still, I think, a little bit problematic. Still clicking and pain. And there's the nose, before I forget.
What's going on with the nose?
I think there might be like a deviated septum. I think that's what
We'll
it's
keep an eye on that. There you go. Little more. Oh. Good. Feedback. How's the right leg right now?
better.
Good.
I can tell, yeah.
Good.
Milder.
How's the neck and the shoulder doing?
The thing you do on the neck, it affects my shoulder, I can tell.
Absolutely it does.
Yeah. It is kind of sour right now, a little bit painful, but it's better. Hopefully.
Oh, so again, it's to be expected.
Yeah.
Because everything else in your spine is quite unstable there.
Yeah.
All right, last part. That's it. Okay. Glasses off, please. It is out. Just slightly. Yeah, it's out. Just set one part. It's a little more deeper in there. I don't know. Get a little piece in there. Good. Yeah, sinus is out. There it is. Okay, come on up.
Wow. This is incredible. Oh.
What's different about it?
Before I wasn't able to breathe from the boat. Wow. So much difference.
Pretty slick, huh? Okay, so here's the story. Okay, I understand that today's your last visit.
Mhm.
I'm gonna head back to Miami. All right. So here's the story. Because you have actually a triple whammy going on in your pelvis there, sacral segment, your left hip, and your fourth lumbar. All those three it's a really bad type of catch-22. We address one, the other one goes out. We address this one, the other one goes out. You know, so in other words, we had that trifecta of issues going on. All three needs to be stabilized in order for everything else to stabilize as well. So in other words, whenever you start feeling and noticing this left shoulder of yours start coming out, the foundation went out.
Okay.
Right? It's one of those three that keeps on coming out.
Okay.
So you gotta stabilize that. I recommend continue seeing that Gonstead Chiropractor in Miami. Do what I recommend to you. All right?
Okay.
To carry the rest of the way.
Okay.
Right?
Thanks so much.
Okay. It's been a pleasure. I'll see you next time.
Thanks so much, doctor.
Okay. Have a good one.